Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here for Gold Learning. And today I'm chatting with Debbie Fraser about her upcoming presentation titled Congenital Infection, What's Old is Back Again. Welcome, Debbie.
Hi.
It's good to have you here. Debbie is one of our speakers at the Gold Neonatal Online Conference of 2022. And what we like doing here at Gold is chat with our speakers before the conference so our audience can get to know them and learn a little bit about them and their fantastic work they're doing out there. So Debbie, first of all, since this is an international conference, where in the world are you located?
I'm in Winnipeg, Manitoba, Canada.
Beautiful, wonderful. That sounds fantastic. And before we jump into the topic here of your presentation, tell us a little bit about your background and your professional journey.
Sure. I have been a neonatal nurse for going on to 42 years now. I'm just starting my 42nd year in the newborn intensive care unit. I've been a neonatal nurse practitioner since 1981, and I have been fortunate to be one of the first neonatal nurse practitioners in Canada. And so it's been an interesting journey to pioneer that role. I've also been the editor of Neonatal Network, the Journal of Neonatal Nursing, for the last almost 20 years, and have really enjoyed working with authors around the world.
Oh, wonderful. Thank you so much for sharing that. And you mentioned you're a pioneer in your role there, and you've been in the field for, you said 42 years. Yet I mean, a lot has changed since the beginning, right? I mean, you're looking back over your career, I mean, the technical changes that we had over, I mean, it must have been quite a journey for you looking back, seeing what we can do now in the NICU from when you started out, right? Tell us a little bit about that.
Tremendous changes. So going from having all of our babies in incubators to now practicing kangaroo care, skin to skin, immediately after birth with our babies, and seeing moms in the unit being an active part of their infant's care. It's a tremendous change that I think has been very positive. So it's not only the technology that's changed, but it's also our approach, our overall approach to providing care for extremely low birth weight babies, and the involvement of family and the opportunity to partner with families is really a tremendous advance that we've seen.
Yeah, you brought up something very important there. Yeah, it's not the technology, it's really the care, right? And you mentioned in the beginning of way back, all babies were in the incubators, and now we're practicing kangaroo care, skin to skin, absolutely wonderful. And that is low tech. That is going back to what is really, important, and is backed up by research, of course, as well, evidence-based. So that's absolutely fantastic. Thank you for sharing that too. And, also very important there is human milk, breast milk as well, right? That has also probably changed as well, that breast and human milk has always been important, but I think there is a new understanding of how important it is really for little ones in the NICU, right?
Yes, to have an all human milk diet, to use donor milk if mom's milk is not available, and the tremendous amount that we've learned about how to help babies grow through fortification of breast milk has also been really critical to sending home babies that are much better equipped to deal with the world.
Absolutely. You are also an author. You have published 3 textbooks and over 70 book chapters and peer-reviewed articles. That's quite a lot. That's quite an achievement there. That's absolutely fantastic. Can you tell us a little bit about your work there?
Well, I thoroughly enjoy writing, and of late, more specifically, I enjoy mentoring authors and working with both nurse practitioner students, clinical nurse specialist students, as well as polished and seasoned authors. So the opportunity to mentor people to share their wealth of knowledge has really been a highlight of my work as the editor of Neonatal Network. The books that I've published are really intended for neonatal nurses. So one is on neonatal infections, and the other one is on acute respiratory care. And then the third one is a group effort from my university for nurse practitioner guidelines. So again, book chapters are a lot of work, and unfortunately, we know textbooks are out of date almost as soon as they're published. But I think they still provide a valuable resource, especially for those that are new to the profession or for the students that are coming up through the ranks. So it's really a privilege to be able to share that knowledge and the process of publishing with others.
Oh, wonderful. Thank you for sharing that. Now let's talk a little bit about your presentation. It's titled Congenital Infections, What's Old is Back Again. And you will be talking there about syphilis specifically as well. So tell us a little bit what we can look forward to learning from you.
Well, I think we need just to look a little bit at the background of the impact of infections in the intrauterine environment. So it's important to understand the timing of those infections and the types of effects that they can have on the development of the fetus. And then from there, we move in to talk about some of the most common intrauterine infections that we see in NICU patients. And so understanding the impact of specific infections as well as how to recognize the signs and symptoms of various intrauterine infections is really important. I talk a little bit about some of the testing that we do, as well as some treatments, and a little bit about the prognosis, because it's certainly variable depending on which type of virus it is. And it is predominantly viruses that we speak about, although there are some other agents that can cause infections as well.
Well, wonderful. Before I let you go, Debbie, what can you share, if any last words for us on the topic or in general that you would like to leave us here with?
I think it's an important area for because of the impact that it has on the fetus. And so being able to work from a preventative side will be important as well. Of course, by the time we see the babies, those infections have already happened, but I think it's very important for practitioners that provide care to pregnant women to understand the potential devastating impact of these intrauterine infections.
Yeah. Was it a surprise to you that some of the older, I don't even know how to title it, infections are back again, like, you know, that we've seen in the past, and we thought we kind of were over all that, and we see a kind of a resurgence? Was that a surprise to you, or?
Well, it's been a surprise to me in practice. So I've been in practice, as I said, for 40 years, and I learned about congenital syphilis when I was a nursing student.
Right.
But I really didn't see any congenital infections related to syphilis in my practice until the last 5 years. And now increasingly, I'm seeing more and more babies that have come into the nursery either with stigma related to syphilis infection or with a history of a positive mom and needing to be tested and treated. So it's certainly, from a practicing perspective, been a bit of a tragic surprise to see the resurgence of syphilis and the numbers of cases that we're seeing right across North America.
Well, Debbie, Fraser, thank you so much for your time sitting down here with me and talking about the wonderful work that you've been doing, your research, and of course, the presentation that you will be having here with us at the Gold Neonatal Online Conference 2022. Well,
thank you, Kristen, and thanks for the opportunity to share this with your audience.
And thank you. And for our viewers now, this presentation will be live on June 13th. And it is part, as I mentioned, of the Gold Neonatal Online Conference of 2022. If you would like to find out more about this presentation or any of the presentations in the conference, we invite you to visit goldneonatal.com. Thank you, everyone, for viewing and listening, and I hope to see you at the conference. Bye-bye, everyone.
Thank you.